Picture this, you're 47 years old. You've got a decent job, a mortgage, 2 kids, and lower back pain that's been bothering you for about 6 months. At first, you thought it was from sitting at your desk too much. Then maybe you slept wrong. Then maybe you're just getting old and this is what 47 feels like. You take some ibuprofen, ignore it, and keep going. But then you start losing weight without trying. 10 pounds in 2 months. Your pants fit better, you think, hey, maybe stress is finally good for something. Then you notice you're tired all the time, not sleepy tired, but exhausted tired, like your body's running on fumes. Food just doesn't appeal to you anymore. Your spouse has been nagging you to see a doctor for weeks. You finally go, mostly to get them off your back. You're thinking maybe it's diabetes, low testosterone, something fixable with a pill. The doctor runs some tests, blood work, a CT scan. You're not worried. You feel fine mostly, just tired and sore. 2 weeks later, you're back in the doctor's office and they're using words like mass and pancreas and stage 4. They show you the scan. There's a tumor the size of a golf ball and it's already spread to your liver. You ask what the treatment options are. The doctor pauses just a little too long before answering. That pause tells you everything you need to know. Before we talk about what's growing inside you and how it's going to kill you, let's bust a few myths. Myth 1, cancer always causes pain, so if you're not hurting, you're fine. False. Early stage cancer is often completely painless. By the time it hurts, it's usually already far along. Myth 2, if you eat healthy and exercise, you won't get cancer. False. Healthy habits reduce your risk, but they don't make you immune. Genetics, bad luck, and random cellular mutations don't care about your kale smoothies. Steve Jobs could afford the best healthcare in the world and still died of pancreatic cancer at 56. Myth 3, chemotherapy cures cancer. It depends. Sometimes chemo kills the cancer completely. Sometimes it just shrinks it temporarily. With pancreatic cancer specifically, chemo usually just buys you a few extra months. So what is cancer, and why does it kill you in such a slow, methodical way? Cancer isn't one disease, it's hundreds of diseases that all share the same basic problem. Your cells start multiplying when they're not supposed to. Normally, cells grow, do their job, die, and get replaced. But sometimes a cell's DNA gets damaged from smoking, radiation, a random copying error, or sometimes nothing at all. That damage causes the cell to ignore the normal rules. It stops dying when it's supposed to and just keeps dividing, making copies of itself. Suddenly, you've got a tumor, a mass of cells growing where they don't belong. Here's what makes cancer so brutal. It doesn't kill you directly. The tumor isn't stabbing your organs or poisoning your blood. What it does is slowly steal resources from the rest of your body. Cancer cells are energy hogs. They consume massive amounts of glucose and nutrients, leaving less for your normal cells. This is why you lose weight without trying. Your body is literally being consumed from the inside by its own mutated cells. As the tumor grows, it starts pressing on things it shouldn't. In pancreatic cancer, the tumor can block your bile duct, causing jaundice. It presses on nerves, causing pain. It can block your intestines, making eating nearly impossible. And then there's metastasis, the spread. Cancer cells break off, travel through your bloodstream, and set up in other organs. Pancreatic cancer loves the liver. Once there, it destroys liver tissue and replaces it with more tumor. When your liver starts failing, everything starts failing. Let's walk through the next 6 months of your life, from diagnosis to death. Month 1, the oncologist explains your options: chemotherapy to shrink the tumor and buy time, or palliative care to keep you comfortable. You choose chemo. You've got kids, you're not ready to give up. Within 2 weeks, you're nauseous constantly, your appetite is gone, and your hair is falling out. The back pain is worse. They give you opioids, which help but leave you foggy and constipated, a lovely addition to the nausea. Months 2 and 3, multiple rounds of chemo later, the scans show the tumor hasn't grown. The doctor frames this as good news. What they don't say is that hasn't grown doesn't mean is shrinking. You've lost 30 pounds. Your clothes hang off you. People keep telling you that you look thin, using that sympathetic tone that really means you look like you're dying, because you are. Your skin is yellow now. The tumor is blocking your bile duct completely. The pain is constant. They've increased your opioid dose 3 times. The tumor is pressing on a nerve bundle behind your pancreas, and it feels like someone stabbing you in the back with a hot knife around the clock. Month 4. The oncologist sits you down and says the chemo isn't working. The tumor is growing despite treatment. It's time to think about hospice. You stop chemo, and honestly, it's a relief. The side effects were almost worse than the cancer itself. You've lost 50 pounds, you look skeletal. You spend most of your time in bed. Friends and family visit and try to act normal, but everyone's crying in the bathroom when they think you can't hear. Your liver is failing. Toxins are building up in your blood. You're confused sometimes. Your brain is being slowly poisoned by your own body. Months 5 and 6. You're on continuous morphine through an IV drip now. The pain is too severe for pills. You're not really conscious most of the time, just drifting in and out of awareness. Your kidneys are starting to fail. You're not eating. Your breathing is shallow and irregular. Your lungs are filling with fluid. Every breath sounds wet and labored. The person lying in that bed barely looks like you anymore. You take one more breath, then nothing. Your heart beats a few more times out of habit, then stops. Time from diagnosis to death, 6 months and 3 days. What does dying from cancer actually feel like? At first, before the diagnosis, it feels like nothing. That's the insidious part. You're tired and your back hurts, but you just think you're getting older. There's no dramatic moment of realization. After diagnosis, it feels surreal, like they've made a mistake, like they're talking about someone else. Then chemo starts and it feels like poison because it is poison. Everything tastes like metal, your body aches, you can't think straight. And you're doing this to yourself voluntarily because the alternative is worse. As the cancer progresses, it feels like your body is betraying you. The pain is the worst part, not like stubbing your toe or breaking a bone, which heals. This is chronic, grinding, relentless pain that never stops and only gets worse. Even with morphine, it's always there. Toward the end, it stops feeling like much of anything. The morphine keeps you in a fog. Sometimes you're lucid enough to recognize your family. Sometimes you don't know where you are. There's no poetic moment of acceptance or peace. You're just too tired and too drugged to care anymore. And then you simply stop. Not dramatic, you just gradually fade until there's nothing left. Reality check. Cancer kills about 10 million people every year worldwide. Pancreatic cancer has a 5-year survival rate of about 10%, and most people die within a year of diagnosis. There's no reliable early screening test. By the time symptoms appear, it's usually already spread. So that back pain, that unexplained weight loss, that constant fatigue, get it checked. The difference between catching cancer early and catching it late is the difference between possibly surviving and definitely spending your final months in a hospice bed. Your doctor would far rather see you for something that turns out to be nothing than see you 6 months later when it's stage 4. Listen to your body, get your checkups, stay safe.